Hey, I'm gonna go on my computer because my phone's about to die.
Okay. Hey, girls, talk to me for a second so I can hear your background.
Hello.
Okay. All right.
Hello.
It's you, Emily. Yeah, I thought so. For some reason, yours is doing the. That's okay. We'll just mute it. I'm trying to look for. I thought we had an area where we could talk to each other. You guys have a chat on yours? Oh, there it is. Never mind. Okay.
Meredith said send me a link.
Okay.
Do you want me to try my computer?
It might work better.
All right. Will one of you invite me, please?
Yep, I'll invite you right back.
Thank you.
The quiz kind of confused me on the ones that said A and B only. And because it was all mixed up.
It was mixed up?
Yeah. It wasn't. I don't know. I'll send you a picture and send it in a text. It wasn't like it said A and C and it was at the bottom. I'll send you a picture.
Okay.
Are you talking about the one that says what is antiseptic must be used when collecting a blood alcohol test?
Yes.
A and C and D's on there.
I didn't have any choices is what I'm saying. There was an A, B, or it was just the words.
Oh.
Oh. That's weird. Did you have choices, Emily?
For which question?
What is antiseptic must be used when collecting a blood alcohol test?
Mine said C and D and then had the like A and C and.
Yeah, that's what mine had.
Okay. We'll figure it out.
I studied for like 10 minutes and I still got 100.
All right. You guys ready for this? Well, I'll look at it. Rebecca, I'll look at it in a little bit, okay? Okay. So we're going to do chapter 14. And maybe what we can do is on the chat, if the question comes up, you guys just put an answer in the chat.
Okay, you change your name.
Okay. Okay. So we're going to talk about special collections. All right. Things that influence and change the way we collect blood, or it could influence the results. Could be things like age. If somebody's been drinking alcohol, it's going to change it. If you're at a different altitude, so we talked about that. If you go into, let's say you went to Colorado, your blood work might be different, like especially like your oxygen levels will be different at a higher altitude than a lower altitude. Okay. If somebody is dehydrated, different things, you know, if we're doing a blood glucose and somebody's just eating a whole cake, we're going to have a different result, right? So, you know, that's going to happen. There's things like exercise can actually alter a lab result. If you're female or male, that'll also could alter the results. Certain medications, let's say you're on a blood thinner, or if you're taking aspirin, that's going to change your CBC. if you're getting any kind of medical treatment. So if you're getting chemotherapy or something like that, that definitely would alter it. Obesity can alter your labs. Just your posture in general could also alter the lab. Pregnancy, of course, hormones are flying, change it. Smoking and stress. Okay, so these things are all could interfere with that. I think that's Rebecca's. All right. Did everybody, I didn't have time yet to look, but did everybody get their the form in that Kathy wanted in?
Yeah.
I'm doing mine tonight
All right. Okay.
because I don't know how to scan them. My mom knows how.
Okay. Fasting specimens. So when patients have not eaten or drank anything for 8 hours, so that's what fasting is. You have to be fasting for about 8 hours. Okay. If the fasting specimen is requested, the phlebotomist must ask the patient if they have been fasting. Okay, so that includes water, caffeine, nicotine, anything like that. Okay, we have to make sure that they haven't done anything for the past 8 hours. Time specimens are most often used to monitor medication levels, changes in the patient's condition, normal variations of various substances throughout the day, different things like cardiac enzymes used to diagnose like MIs or heart attacks. These are tested at admission and then twice more at 8-hour intervals. So these are just examples of time specimens. Okay, so time specimens are most frequently collected to monitor medication levels, true or false. Can you go to the chat?
Two.
All right, so let's see what we got. That's right, true. So time specimens are most frequently collected to monitor medication levels. Okay. How is 2:30 p.m. expressed in military?
Oh gosh.
Yeah, don't me.
I was just there on military base. 14:30.
I think you're supposed to do it in the chat.
I can't do it in the chat. It won't let me.
You can't type your answer in the chat?
Nope.
Go to participants and click her name.
Oh, okay.
All right. 14:30, girls, you remembered. All right. So the diurnal variation, this refers to the normal daily fluctuation of your body chemistry. So throughout the day, our body goes through cycles, okay? It goes through hormonal cycles. It does a sleep-wake cycle, and it does other regular patterns. So that's what it means when you're talking about diurnal. So it's what your body normally goes through throughout the day. Okay? Many substances in the blood, especially the hormones, show variations throughout the day. Cortisol, for instance, is usually twice as high in the morning as in late in the afternoon. Right? So if we were doing a morning opposed to a late afternoon, we might see a big difference.
Do you want us to mute ourselves because I hear echo?
Yep, go ahead. That's fine. So things that show marked variations are, like I said, the cortisol the estradiol, progesterone, so some of your hormones, the testosterone, iron, glucose, and white blood cells. So they show the most variation throughout the day. All right, so therapeutic drug monitoring. So we would be looking for levels of drug monitoring or therapeutic drugs, okay? So patients differ in the rate at which we metabolize. So I'm a good example of, I'm always having to take like an infant or a child dose of medications because my metabolism does it differently. So I get actually a bigger boost from what normal people wouldn't feel anything. So, you know, that's an example of different ways that people metabolize things. To maintain constant therapeutic plasma drug levels and to assure that drug doses not reach toxic levels, that's why we're doing these, okay? So we want to make sure that the medications we're giving them, we want to be a therapeutic drug versus something that might become toxic. Collection is usually timed to coincide with either the trough or the peak serum level. The peak level or the highest serum level occurs sometimes after the dose is given. Okay, so that would be the peak level, and then it would slowly go down. Okay, let's talk about diabetes testing, because you'll probably see a lot of this in phlebotomy. Remember the 4 types of diabetes that we talked about. Type 1, remember, was the juvenile. So it's early onset. You definitely need medication for that one. Type 2 could be caused later in life. It's more seen in adults. A lot of times, if you adjust the diet and increase exercise, that can be controlled. Gestational is the one where when you're pregnant, it happens to you, okay? And then, of course, diabetes can be caused by other causes, like, you know, if you have cancer, et cetera, it may put you into diabetes. Okay. Diagnosis of diabetes or prediabetes relies on the results of 4 tests. The first one you hear all the time about is A1C. The other one is a fasting glucose or a random glucose, or one that we're going to talk about a little bit more is the OGTT, okay? Tests for diabetes and other disorders of carbohydrate metabolism. So that's what we're talking about when we're talking about the oral glucose tolerance test, OGTT. Remember those acronyms. It measures the change in blood glucose after drinking a very sweet solution. So the person would drink the solution within 5 minutes, which is pretty gross and pretty thick. Okay, it's like drinking pure sugar water. So they'd have to get that down in 5 minutes, and then you would start doing some testing, and it would be timed. And let's go into that, I think. Okay, let's do this first. Within what time should the person have that drink down? Should be pretty easy.
$15 minutes.
Remember, use your chat, girls. Okay, let's see what it is. So when you get that glucose sugar water, you've got to drink it within 5 minutes. Okay, 5 minutes. Okay, so the person drank their sweet stuff, okay, in 5 minutes. You'll start testing the person. So a 2-hour glucose tolerance test. So these are things right here, girls, that I want you to learn, okay? We're going to need to know this part right here. So a 2-hour glucose tolerance test would actually have 3 different lab draws. You would have the fasting, which would be right before they drink the sweet stuff, okay? Then you would do one in an hour, and you would do another one in 2 hours. So that's what it means for 2 hours. So there's 3 sticks, one before the drink, 1 hour, and 2 hours. A 3-hour essentially is the same thing. You're going to do a fasting, then they're going to drink it in 5 minutes. You'll do one at 1 hour, 2 hours, and 3 hours. And then the 5, of course, is fasting, 1 hour, 2 hour, 3 hour, 4 hour, and 5 hour. Does that make sense? Okay. I lost Meredith. Where'd she go? Oh, there she is. All right. All right, so let's talk about this. A PCT missed the 0900 specimen collection. That's supposed to be 4, little typo, for a patient's glucose tolerance test. Which of the following actions should take place? What do you guys think? And you can answer in the chat, please. Okay, so you were supposed to take it at 0900. The patient has done their drink, right? And we're expecting some kind of result. So we probably would not stop the test and prepare to do it another day because this person has gone through a whole 8 hours of fasting. Okay, so we probably don't need to do that. We log the collection as unable to obtain. We probably wouldn't do that one either. So then we come down to C and D. So here's the dilemma. We go ahead and perform the collection, but do we put the time that it was supposed to be taken at 0900 or do we put the time that we took it? I'm thinking we put the time that we took it. Let's see. Okay, so we missed it. We put this person through 8 hours of starvation. We make them drink this awful thing. We go ahead and put on there that we were late getting it, and we put the exact time that we took it. Okay, all right. All right, now here's that. So for a 3-hour OGTT, how many blood samples will be collected? I don't think that's right. You guys think that's right? No, I think this was supposed to say a 5-hour. Okay, so we're going to say 4. Is that what you said? So let's go back because I don't think that question's right at all. That's a nice typo. All right, let's go back. So for a 3, it would be 1, 2, 3, 4. I think that was supposed to say 5 because there's actually for a 5, there's 6. Okay, so you guys were right. Okay, other tests. So other tests are tolerance tests for like lactose. Have you heard of people who are lactose intolerant? Emily, have you heard of those kind of people? So this is a test. This is a test that would determine if you actually are lactose intolerant, okay? They also can test stool acidity. A lot of children have problems with that. And this can be detected in a stool or fecal sample, okay? So these are other tests that we're going to talk about. We're also going to talk about a little bit about blood cultures. A blood culture is ordered to detect the presence of some kind of microorganism in the blood, okay? And this could be life-threatening. This could be bacteria, fungus, protozoas, you know, sepsis could be life-threatening. So we want to determine if there's something in the blood. Types of collection containers. So there's 3 basic types of containers for collecting blood cultures. There's one that's called a long neck bottle, which accepts a blood, a BD vacutainer needle and tube holder. And you'll see that in your book. a shorter bottle, which accepts a winged infusion device, okay, or a standard evacuated tube with sodium, polynate, sulfonate, and anticoagulant in there. So these are just different kinds of devices. So site preparation is with antiseptics, okay? Prepare antiseptic preparation on the skin and it reduces the normal skin flora, okay? So we want to reduce the risk of a false positive. So we're going to use like an alcohol preparation. You could use povidone iodine or the CHG are the preferred three, okay? So timing, the number of organisms in the bloodstream is often highest before a spike in the patient's temperature, okay? So if if the nurses are seeing that this patient's temperature is going up, they're probably going to have a lab drawn as they feel it's going to be at the top of it, okay? So we're going to take blood, we're probably going to take a blood sample at that point. But we're going to frequently record the temperature, and then these spikes can often be predicted so that they can get a hold of a phlebotomist to come up and take it at appropriate times, okay? When we do a blood culture, we are going to take it from different sites, meaning we're not just going to take the blood culture from one site, okay? Contamination of a sample by skin bacteria is frequently complicated. It's kind of a complicated blood culture collection. So to reduce errors by this contamination, a known skin contaminant must be cultured from at least 2 different sites. Okay, so we're going to take it from 2 different areas to make sure that we're seeing what's going on inside. Okay, this is how we're going to do this. Okay, so we're going to prepare the site. After identifying the site, scrub it vigorously with alcohol to clean 1.5 to 2 inches beyond the puncture site. So it's going to be a bigger than usual area. Then it says scrub vigorously with 2% iodine swab stick. So first alcohol, then the swab stick. Avoid touching the site once you clean it, so you can't touch it anymore. You're going to allow it to dry for 1 minute. So you have to make sure that the iodine kills all of the bacteria on the surface. Then you're going to prepare your collection equipment, clean the tops of the collection bottles with iodine or alcohol. And that kind of depends on your institution. So it says immediately before inoculation, wipe the top with the pad to prevent iodine contamination of the sample, and be sure not to touch the bottle tops directly. Again, all of this is going to make sense when you're actually seeing it and doing it, okay? We're just having to learn the steps. Collect the sample, reapply the tourniquet, and perform the venipuncture, okay? So we're going to put the tourniquet back on, and then you're going to do the venipuncture. You're going to collect 2 samples. And this is where I want you to kind of remember, again, it's yellowed, right? So you're going to label one of your samples anaerobic and one of them aerobic. And then you're going to put what the site was. So like if you took it from, let's say, you know, this area, and then you took the other one from down by your radial, you're going to make sure that's on those tubes. Of course, you're going to attend to the patient, clean them up, apply pressure and the adhesive bandage, etc. Okay. Okay. So some people donate blood. So this is a whole nother area of phlebotomy. So blood donation, of course, we know is really needed. Blood banks collect and store donated blood for use in emergencies or scheduled transfusions. So we'll talk about what you can do for yourself if you know you're having something come up. Potential donors must be screened to ensure that donation is not harmful. Okay, so they're going to screen the blood. This involves registration, interview, medical history, and a physical exam. Blood is collected by the unit whose volume is 400 to 500 milliliters, or approximately 0.5 liters. It's collected directly into a sterile plastic bag, which hangs below the collection site and fills by gravity, okay? Hangs below the collection site. The weight of the filled bag triggers a clamp that stops the collection. Usually a 16 to 18 gauge needle is used. Now this is where, if you know you're going to have surgery, let's say in a month, you can actually donate your own blood and they will store it for your surgery, okay? And this is called autologous donation, okay? Patients planning surgery often make this their own donations. Because multiple units might be needed during surgery, patients may need to donate several different times. So they might come in 1 week and then come in the next week and then come in the next week, okay? A patient can donate as often as every 72 hours, assuming that his health is good. So every 72 hours. Okay, this is kind of interesting. I think back in the centuries ago, they used to call this bloodletting. Did you ever hear of that? Where they would actually take, what are those called? Bloodsuckers, you know what I'm talking about? Like it's some kind of like little worm, you know what I'm talking about? They used to actually attach those to people way back in the centuries to take, yeah, remember that? Yeah, leeches, yeah, that's it, leeches. So they actually, you know, way back then, they even knew that some people needed that. That's kind of weird, but that's, you know, that's how they did it back then. Okay, so this is kind of what that is like. So there's some therapeutic phlebotomies, the removal of the patient's blood from the system, okay? In certain disorders like polycythemia, a disease characterized by too much red blood cells. So I think that, you know, back in the centuries, that's what they were doing, is that they knew that these people were making too thick of blood, and they would put these leeches on and let them pull some of the blood out. So that's kind of what we're doing it without using the leeches. So that's what this means, okay? So they use it with polycythemia and also hemochromatosis, which is an excess of iron in the blood. In both cases, periodic removal of a unit of blood may be part of their treatment program. So that's the therapeutic. Okay. Cold agglutinists are antibodies often formed in response to infection with mycoplasma pneumonia. Okay, is an atypical pneumonia. The antibodies created by the immune system during the infection may also react with red blood cells at temperature below body temperature, causing them to stick together. So they kind of get real sticky and gather up, okay? All right, so here's a warm collection and storage are required for 2 other types of samples. So this is warm collection. Fibrinogen, whatever that is, an abnormal type of fibrogen, okay, and an abnormal serum protein. These samples should be collected and handled in the same manner as cold sample. All right, chilled specimens. A number of tests, like ammonia levels, require that the specimen be chilled immediately after collection. Chilling is used to prevent the chemical changes that would alter the test, okay? So ammonia is like one of them, okay? In your book, there's a list, so you might check that out, but ammonia is one of them, and it needs immediate chilling. The sample should be placed in a crushed ice or an ice-water mixture and immediately delivered to the lab. A PCT has just collected a specimen to determine the patient's blood ammonia level. Which action should the PCT take? Remember to go to your chat. Okay, so there's that ammonia level that we talked about. So we just drew it, and that's one of those that needs iced. So we're going to go right away and submerge it in ice slurry, which means ice slurry kind of means water and ice mixture. Okay. Okay. All right. So then there's some specimens that are light sensitive. And again, the book's going to list several of them. Exposure to the light can break down the blood constitutes. So specimens that are on that list need to be, you need to make sure that it doesn't get exposed to light. A amber colored microtube can be used for dermal collection. For instance, like bilirubin, remember how bilirubin is one of these light sensitive samples, and also B6 is another one. So you might be using a amber colored tube to protect it from any kind of light. Okay. Also, this is done by wrapping the tube in aluminum foil immediately after collection. So right after you collect it, you would put it in an aluminum foil and it would protect it from light until you got it to the lab. The most common light sensitive analyte is which one of those? Okay. Bilirubin. Okay. Okay. So legal and forensic, that includes things like drug screening, alcohol, testing, that kind of thing. So you might be involved in that. You might work for a private lab. Blood specimens may be collected for the use of legal proceedings. Okay. You might also be determining somebody's DNA, or if there's a child custody or something like that, they may be determining. So you might be involved in that. And with that comes a chain of custody. So it's even though you do very carefully document what you're doing in the lab, when you're working with legal and forensic stuff, it's even double that. Okay. So there's this chain of custody and this protocol that you'll follow, and everybody's different, but there's certain steps. And we'll talk a little bit about, especially like if you're doing a drug screen in the bathroom and stuff. Okay. It's very interesting what you have to do. And it's also very interesting how creative people who are trying to hide the fact that they're doing drugs or alcohol get. And I've actually been involved in that. So to see how they can get very tricky. Okay. So all toxology and drug screens need to have a CBC, a CBC, a COC, or a BOB. Okay, let's see what it is. Chain of custody. Okay, so COC is chain of custody. So all toxologies and all drug screens have to have a chain of custody. The purpose and procedure of tests must be explained to the patient. So we cannot go in there and sneak a drug screen or an alcohol test. Okay, we have to tell them what we're doing. The patient must sign a consent on top of that. The patient must present picture identification. So if you have to go in for a drug screen for a job interview or whatever, they're going to ask you for your legal documents to make sure you're who you are. You're not having somebody else take your drug screen for you. Okay. The specimen must be labeled appropriately and establish that chain of custody. The specimen must be sealed in such a way that there cannot be any tampering in between that you collecting it and taking it to the lab. And then it has to be actually placed in a locked container before you even transport it. Okay. So let's talk a little bit about alcohol testing. The collection for alcohol testing is most common in emergency departments. The site must not be cleaned with alcohol, okay, as this would falsely elevate the result. So we learned that already in a few chapters before. We're not going to clean the person's arm with alcohol and then draw, because that's going to alter it, okay? The tubes must be filled as full as the vacuum allows. So you're going to try to fill up that tube all the way, okay? Because if you leave space in there, it can alter the, the alcohol that's in the blood can escape from the sample. So you want to try to open that or fill it up. You're going to note on the requisition form the site was cleansed with soap and water or some other non-alcoholic solution. Time-sensitive blood constitutes. Here's just a few of these. ACTH, ammonia, et cetera, okay? Blood smears. So blood smears are made to allow microscopic examination of blood cells. The blood smear is used for determining the like blood cell types, differential counts, and performing special staining procedures. Blood smear. So again, just kind of glance in your book and make sure you kind of have looked at the procedures. We're going to go more over that when you actually start your clinicals. Blood smears are usually prepared following dermal puncture. Slides are made in pairs. Okay, you're going to place 1 drop of blood on a clean slide, a half to an inch from the end, centered between 2 sides. Place the edge of the second slide, the spreader, onto the first slide in front of the blood at a 25 to 30 degree angle and draw it back to just contact the drop. Move the spreader slide forward away from the drop in one continuous movement. And again, this is all going to make sense when you see it, okay? You're going to examine the smears. So an acceptable smear must have feathered edging, meaning that the cells appear to thin out farther from the original drop. So we want to see from the center of that drop it to smear out. You don't want this big glob and you didn't smear it out. We want it to get thinner on the way out. At the far end, you should see a very thin, transparent layer. Unacceptable smears. So there's several here. Holes in the smear. So it's called a dirty slide. So you had a slide that wasn't clean. You put too much blood on the little slide. You didn't place it close enough to the far edge, and you didn't lift it before it reaches the edge. Too thick and too long, et cetera, okay? So there's different reasons that they won't accept it. And these are all just it. Okay, when preparing blood smears, at what degree should the spreader slide be? Do you remember? $25 to $30, okay? Okay, malaria smears. So that's another one that you would do a blood smear. Malaria is caused by blood-borne protozoa. A patient with malaria has cycles of fever and chills that coincide with the life cycle of the parasite. So malaria is actually a parasite, and it is diagnosed with the blood smear. To make the smear, use a larger drop of blood and spread it out only about the size of a dime. The sample must be allowed to dry for at least 2 hours. Then stained to reveal parasites. Okay. All right. Malaria is diagnosed with a regular smear and a thick smear by using a large drop of blood and then a thin smear and spread the drop to the size of a dime. Is that true or false? Okay, true. Okay, so let's look at that so you remember that. Malaria is diagnosed with regular smears and then a thick smear. Okay, so it's going to have a regular smear and a thick smear by using a large drop of blood, then a thin smear and a spread the drop to the size of a dime. Okay, a lot there. Okay, so were you guys, did everybody, I haven't had a chance again, did everybody do their test bank questions today? Yes, no, maybe?
I did them yesterday.
Okay.
Will it show you that I did them, or do I need to submit a picture?
Do not have to submit pictures, girls. I will go in and then look at them and then put them on your Blackboard. So don't worry about that. Yeah. All right, so everybody did that on that chapter, right? Okay,
Mhm.
let's go through the questions real quick at the end of the book. I'll read them.
Wait, what chapter was that for the
14.
test bank?
14,
For the test bank?
chapter 14. Oh, I don't know what was due today. Let's see. Do you guys
I
remember?
think it was 12 and 13, but I did them both.
Whatever was due today, I want to make sure that you guys did them. Okay. All right, so chapter 14, page 232. Time specimens are most frequently collected to monitor. I'll wait for you guys.
Hold on.
Okay.
14. Get there.
Okay. Getting warm there, Emily? Okay, here we go. Time specimens are most frequently collected to monitor, what do you guys?
B,
B, that's right, medication levels. 2, hyperglycemia. Hyperglycemia means which one?
C,
B, that's right. Okay,
What was it?
it's C, it's increased glucose. So hyperglycemia means increased glucose. All right, let's see, here's this one. For a 3-hour OGTT, how many blood samples will be collected?
B.
D, 4. Good. Within what time period should a patient drink the glucose solution required for a OGTT?
A.
Good, 5 minutes. All right, BC, or blood culture collection, involves
B,
D, that's right, an aerobic and anaerobic sample. So remember this, when you're doing a blood culture, you're taking a sample from 2 different areas, and then you're labeling one aerobic and one anaerobic, okay? And we're also going to be labeling where we collected it from, okay? Therapeutic phlebotomies are commonly performed on patients with
D,
Dog.
dog, yep. Yeah, so hemochromatitis and polycythemia. All right, to collect a cold agglutinin sample, what you guys think?
A.
A, that's right. So we're going to warm the sample tube for 30 minutes before collecting. Which specimen requires chilling during transfer to the laboratory?
C,
Yep, ammonia. When making smears for malaria,
dog,
Boy.
I think it's boy. Yeah, prepare 2 to 3 regular smears and 1 thick smear. Okay, it is necessary for a patient to fast for 12 hours before
Is it C?
it is C. Yeah, we don't really need to fast for a blood donation or a blood culture or a therapeutic phlebotomy. So that's the best answer. Factors influencing blood composition include all of the following except
A,
what do you guys think?
or C.
No, I have D, but that doesn't seem, let's see what the
I
book,
have D.
I have a D too. 14. What number is that?
I did have A, but I don't think that's right because in the PowerPoint it said altitude can.
Yes, right.
It also said obesity, so that's why I didn't think D.
I know. Well, let's just go through those. Let's go back to that PowerPoint because I really want to, because the book, like I said, the book in the back is not always correct, which kind of irritates me just a little bit. Right. So let's go here. I want to look at it real quick with you guys. Okay. So let's look at that. So according to this, factors influencing blood composition, all of the following except, and I kind of see everything, don't you?
Yeah.
Don't you see? That's what I mean. That's what I'm. Sometimes the back of the book isn't always correct because it says here age. It says here obesity. You're right, because that's what I was thinking. It says gender, right? Or does it? Nope, it says gender and it says altitude. So I'm saying the book's wrong. I mean, really.
So
Okay.
what's the answer?
None of those. I think those are all. I mean, I would say the book says in the back, they chose for 11, they said B, gender. But I clearly see gender on there. So I'm going to put a big question mark on that. All right. All right, last question. Which of the following specimens is not sensitive to light?
B, boy.
Yeah, lactic acid. Lactic acid. So if anybody wants to go through that chapter and make it their mission to find out that question, number 11, what it says actually within the chapter, might get an extra point somewhere, just so that we can prove and see what's going on. All right, let's move on.
What about if we look it up on Google?
That's a good idea. But then again, we're wondering, all right, let's start here. Let's start. All right, so let's talk about,
I have a question.
yep.
Like, you know how you did like chapter 10 and chapter 11, like separate links? Are you doing 15 with 14?
Well, is there a reason you don't want to do that?
No, I was just asking.
Okay. We'll probably just do it together. And I'll label it 14, 15. Yeah. Okay, so this is non-blood. So we're going to go back to some of the stuff we've already learned, okay? We've already learned about urines and stuff like that. So we're going to kind of just review that stuff. So let's go to chapter 15. We know quite a few of these, okay, already. But so we'll kind of refresh our memory, which is good because when we're talking about the certification, repetition is good. Okay, so we've talked about this. So let's just go through urine. So urine is created by the kidneys and it's a filter from the blood, okay? Urine contains excess salt, products. Let's everybody mute real quick, okay. So it contains, it cleans out and takes all these waste products out of our body, okay? Urine provides a valuable snapshot. So it kind of tells us what the body's doing. So if the body's not working as well as it should, the urine is a great specimen to collect and study, okay? Urine specimens should be delivered to the laboratory within 1 hour, because then things start breaking down, okay? When this is not possible, we want to refrigerate the specimen. A random specimen can be collected at any time. If you guys remember back when we were doing that in 101. So random anytime. It is used to screen for metabolic abnormalities like presence of protein, glucose, blood, etc. in the urine. A first morning specimen, also called an 8-hour specimen, is collected immediately after the patient wakes up. It's more concentrated in the morning, so it'll show more things than later on when things get diluted, okay? For some reason, I can't do a slideshow. Why is that not working? All right. Anyways, a timed specimen. So we talked about that 24-hour urine. You guys remember that? Where we have this big container and we walk into the patient's room and we say, listen, we need you to collect every bit of your urine from 8 a.m. today to 8 a.m. tomorrow. You can't miss it. You can't go into the toilet and forget to do it one time, and et cetera, et cetera. So when we were learning about that and you walked in the room, let's say at lunchtime, and the guy says to you, oh, I forgot to use it just one time, is that okay? Remember that answer was, nope, you got to start all over. Remember that? This is the 24-hour urine, okay? So for 24 hours, you cannot, they have to pee in that container the whole time, okay? It's used to measure the amount of protein, creatinine, and hormones. Creatinine is used to assess the ability of the kidney to clear waste products. So if the creatinine levels are off, that means that the kidneys aren't working as well to clear out the bad stuff, okay? The typical procedure is to have the patient void and discard the first morning sample. So before you start the test, you have them pee and we throw out that one. Then we start the 24-hour, okay? We're going to end at the same time that we started. So if it's 8 a.m. today, it's going to stop at 8 a.m. tomorrow. Exact timing and collection of samples are critical. If the delivery of the urine sample will not be made in 1 hour, the patient may need to refrigerate it until it can be delivered, okay? All right. So you're going to be able to see the answers to this, but that's okay. For some reason, it's not working. Now, let's see here. Why is it not working? I give up. Okay, so a PCT, we just talked about that. So the PCT went in and he said, ooh, sorry, I forgot, and I peed one time in the toilet. You're going to tell him to discard the whole thing, and he's going to get really mad at you. But you're going to say you got to start all over. It all has to go into the container, okay? All right. Next one. Let's see. You guys are like in the middle here. Let me try one thing here. Yeah. All right. That'll move it over a little bit so you can see. All right. Collection procedures for urine specimens. The most common procedure for collecting many types of urine specimens is known as the midstream clean catch. Remember, we did practice this one. Remember when we went in and practiced it? This is going to look at, this allows microorganisms from the urethra to be flushed out and not collected in the sample. So this means that you're going to tell the person to clean themselves, and if you remember how to do that, then they're going to start peeing in the toilet. They're going to stop midstream, and that's what midstream means. And then they're going to put the cup underneath and then collect the urine. Once the cup's filled, they take the cup out and then they can finish going to the bathroom in the toilet. Okay, so midstream means not the first bit of urine, the kind of the middle of the urine flow. Does that make sense? Okay. So if you guys remember, we're going to clean with that sterile soap cleanser. We're opening up with the non-dominant hand if you guys are having to do it. And if you're telling them to do it, then you're going to make sure you instruct the woman to make sure she keeps everything open, clean down the center, et cetera, et cetera. You guys remember that. For the man, remember, they're going to retract the foreskin and clean all around there too. All right, so I talked about that. So they're going to let them pee first a little bit, stop the flow, put the cup under there, fill it up, take the cup out when it's full, and then finish voiding. Okay, put the cap on there. refrigerate it if necessary. We're going to make sure the label, the specimen with the patient's name and the date of time of collection. So we don't ever put the information on the labs until after we collect them. Okay, so that's when we would do that. So a urine specimen is labeled before, after, by the patient, or on the lid specimen. So it's after. Okay, a urine specimen is always labeled after collection. Do you remember the pediatric one with the little? It's almost like, it almost looks like a ostomy bag that we put around the area, and you actually put it around and it sticks onto their genital area, and then we'll put like a diaper on top of that, and that's what would be collecting the urine for the little ones. Okay, it's not a sterile collection. And then once it's filled, we would take that and place that into a cup. That's how we collect it on little ones. All right. A catheterized urine sample is collected by a physician, nurse, or medical assistant, depending on what state you work in, etc. A catheter, you know what that is inserted into the urethra, into the bladder. This technique may be used for culture and sensitivity tests to test if there's a UTI. Okay. Obtaining a normal clean catch specimen is not possible. That's when we do this kind of test, if we cannot get a regular clean catch. Okay. So a catheterized urine sample may be collected when a midstream cannot be collected, when the patient can't pee for some reason, they just can't pee, or and is also collected by a physician, nurse, and medical assistant. Okay, so remember all those. When we can't get a midstream, when the patient just can't pee, and it is going to be collected by a physician, nurse, or medical assistant. So this is a subpubic aspiration sample, and this is going to be done by a physician. So you just need to know that they would actually be taking a needle through the abdominal cavity and inserting it and trying to get a culture that way, but you guys would not be doing this. Urine samples for drug testing. So we kind of talked about this already in the last chapter. We're just going into a little bit more. A urinalysis will reveal the presence of different kinds of blood or drugs. You might have to do this in an outpatient setting. You could be doing it if you're working at a hospital. This is very important as far as the chain of custody. So COC, remember that. It's very important that we follow that. We also are seeing it not just for drugs and alcohol, but we're also testing for things like on athletes, for instance, if they're using performance enhancing drugs, like steroids, etc. So those kind of things. The collection of the sample is usually performed by the patient alone, but in a room without running water. So you might have, you always have to go into that room and inspect it, make sure there's nothing anywhere that they can do stuff. You actually will put some kind of chemical dye into the toilet so that they can't scoop up toilet water, because then it would be, let's say you put blue dye in the toilet. If they put that in their lab cup, you would be able to see that. So there's a lot of different things that you do to avoid them from tampering with the sample, okay? There's, on the container, there will be a thermometer, so that if they brought in urine, let's say, I've seen all sorts of stuff. I've seen people put them in condoms and attach it to their leg, and there's all sorts of little tricks that they try to do. But the thermometer on the container will let you know if they've tampered with the sample somehow, because the body has a certain temperature. Even if they wore it on the outside of their body, it wouldn't be the same temperature as what urine would be. Does that make sense? Okay. So that would be something that you would be looking at. So you would go into the room, make sure there's nothing that can do it. You would probably put something in the toilet so they can't use toilet water. You would check the temperature of the specimen. Then these specimens have, like I said, a special non-tampering seal that you would put on it, so that nowhere between you and the lab could it be altered also, because you will be able to see that. So that's all chain of custody stuff. So a PCT is performing a drug test for a patient, which is correct. So we want to include the location where the test was performed on the chain of custody. We're not going to instruct the patient to flush the toilet, right? Because there goes the blue dye. We're not going to wait 10 minutes to check the temperature. If we did that, then it would be different, right? And we're not going to wait 48 hours to send the specimen. So the best answer is to make sure we designate where we took the sample, okay? Fecal samples. We looked a little bit at that stuff when we were in the lab one day. If you guys remember the smear, there was that little thing where we used the little scoop and we put it on the, okay. The most common reason for ordering this is you're looking for some kind of intestinal infection. You're also screening for colorectal. I think that's probably one of the most common is colorectal cancer, okay? Microscopic examination of the feces reveals the presence of some kind of parasite maybe, or tapeworm. Feces can be cultured to look for diarrhea-causing bacteria also. Types of fecal specimens. A random specimen is used for most determinations, including the bacterial cultures, including the fats and the fibers if they're looking for some kind of digestive disorder. Occult blood specimens are collected after 3 days of a meat-free diet. So this patient would not be able to eat any meat for 3 days. A 72-hour stool specimen is used for checking the fat determination. Okay, so if they have some kind of disorder of the digestive system. All right, so again, you'll get to see it, but so just know that a 72-hour specimen is usually to find out the fat quantities in the stool. Okay. Okay. Occult blood specimen. So we did look at a little bit of that when we were in the lab. So again, you cannot collect it until the person is meat-free for 3 days. They also cannot have broccoli, turnips, raw fruit or vegetables, horseradish, vitamin C, pain relievers such as Motrin and aspirin. So we wouldn't want them taking aspirin and then trying to figure out if they have blood in their stool, because that could be causing that, right? These people would also, if they're going to have that test and the doctor has ordered that test, they would get some kind of literature sent home with them to know what they're not supposed to do. But these will be things that you would ask about. Several types of special test cards are available, which may be prepared in the patient at home and sent in. So sometimes these people just do this at home, okay? Patient, or let's say special procedures for fecal specimens. Patients should be given the appropriate collection container and instructed how to do it, okay? Patients should also be instructed to avoid contamination of the specimen with urine. So we got to make sure that they haven't peed on it. Specimens should be kept at room temperature until delivery at the laboratory. Room temperature, girls, okay? All right, semen specimens are used for, to find out if there's any viable sperm, for fertility testing. Also, if a man has gotten a vasectomy, this test is done to see if it was successful. It may be collected as a forensic specimen for people who may have been raped. Again, it would also have that special chain of custody, I mean. All right, so these are samples of just, talking to them about how to avoid, not to have ejaculation for 3 days. The sample should be placed in a sterile plastic container. The time of the collection should be recorded because sperm die very quickly. And for fertility testing, the volume of semen is also important, so the patient should report whether the sample collected is complete or partial. Okay, so did they throw some of it away or was it a full sample? All right. What is the time limit for delivering a semen specimen to the lab? And it would be 30 minutes, okay? 30 minutes. All right, throat specimens. So right now, this is what everybody's getting done, right, for the COVID? Up the nose, down the throat. A throat culture sample or a throat swab is used to diagnose a throat infection. In particular, it's used for group A strep. Diagnosis is performed with either a standard bacterial culture or a rapid strep test. Let's see here, 15.2. So I made let's look at that. Okay, so on page 240, this is kind of a sample of how you would do it. It's pretty simple. You would have a culturette, so which is a swab, okay? You would need a tongue depressor and a flashlight so that you can see what you're doing. And of course, you're going to have mask and gloves on. You're going to collect the sample by the patient is sitting up. You have them tilt their head a little bit back. You gently kind of depress the tongue depressor down on the tongue. You look in the back of the throat with your flashlight so that you can look and see if anything's inflamed. You're going to touch the tip of the swab quickly to the tonsils and any other areas that look inflamed. Speed is really essential to this, and I think it says that in there because of the gag reflex. So you want to make sure you know what you're doing and you're doing it quickly. Okay, you don't want to be spending a whole bunch of time in there. Be careful not to touch the inside of the cheek or the lips or the tongue. Return the swab to the holder so it has its own special holder. You put it right back in there. And there's like in there is a ample. So once you get the sample in there, you squeeze that and it releases some preservatives so that it'll keep it until you get there, okay? You're going to label the sample and deliver it to the laboratory. So we swab, we place it back in there, we squeeze it so that the preservative now goes in there and takes care of it, and then we deliver it, okay? But the biggest thing on that one is just try to do it as quickly as possible. Things that we're looking for when we do a nasal pharyngeal culture is whooping cough. We're trying to look for whooping cough, croup, pneumonia, RSV, any other kind of respiratory tract infections. So the nasal area and the pharynx, they host a lot of space for infectious organisms, especially in little guys, right? The sample is collected using the cotton swab, and it has like a sterile wire. I don't know if there's yeah, I guess there. So on the next page, you can kind of see the guide, the little sterile wire there, okay? Swab is passed carefully through the nose to reach the back of the nasopharynx. You rotate it gently to collect mucus sample and then remove. So this specifically is what's going on right now on COVID. If you've ever seen them on the news where they're going in there and it looks like they're twisting up into the brain, that's what they're doing. They look pretty aggressive on TV. I think they do that to kind of scare us a little bit. I don't know why. Swab is placed in either transport media or growth media, depending on the test to be performed. Okay, so again, this clearly says rotate gently. The news says they go in there and rake out your brain. Okay, it's not what it is. It's very quickly rotate, and then you take it out. And the guide wire helps it because you're actually going through the nose versus just going through the mouth. Okay, sweat. So sweat is a good indicator of electrolytes, okay? You've got salt when you sweat that comes out. A lot of times we're using this test to diagnose cystic fibrosis, okay? A person with cystic fibrosis has elevated levels of chloride and sodium in their sweat. Sweat electrolyte chloride specimens are subjected to ionocarpine test, which requires special training. Sweating is induced by applying a weak electrical current and that drug to test the area. That drug also increases the sweat. Sweat is collected on a piece of sterile filter paper, which is then weighed and analyzed. Okay, so it's going to test for that. All right, the sweat electrolyte chloride test is typically used to screen for cystic fibrosis, okay? All right, and then there's cerebral spinal fluid. This circulates in the brain and the spinal cord, and it provides nourishment and removes waste from the central nervous system. It's most commonly diagnosed, used to diagnose like things like meningitis or central nervous system infections, okay? It's done by a physician. The phlebotomist will be asked to process and deliver the samples only, okay, after the collection. Cerebral spinal fluid specimens are always delivered to the lab immediately and are analyzed as a stat, okay? It's usually collected by a lumbar puncture, which is a spinal tap. And you guys, I don't know if you know what that is, but it's a needle inserted between the vertebrae of the base of the spine, okay? And about 3 or 4 tubes are collected in sterile containers. Tube 1 is reserved for non-routine studies like cytology. Tube 2 is used for immunology and chemistry testing such as glucose or protein. 3 is microbiology for gram stain and culture. And 4 is hematology cell count, okay? Synovial fluid is that beautiful stuff right between your joints. And as you get older, it goes away. And that's why we get so much arthritis or bone on bone kind of things, okay? So that's what they're checking. So they're looking at the synovial fluid to see if there's joint disorders. They actually can put more fluid back in there to help those joints nowadays. All right, peritoneal fluid is in the abdominal cavity, diagnosing things like ascites. There's pleural fluid, which is around the lungs, okay? And then there's pericardial fluid, which is around the heart. So these are all fluids that are, they do testing on. Now, you won't probably do any of those other than helping and delivering. Amniotic fluid, of course, that's with the little guys, little fetuses. And again, you would not be doing that, but you would definitely be helping with the delivery and assistance with that. Breath specimens. All right, analyzing of breath is used to diagnose small intestine bacteria, some malabsorption syndromes, and H. pylori infection. Collection, patient is given a substance to ingest. Its metabolic byproducts are measured in the breath. Urinary breath test is used to diagnose H. pylori. All right, there's also saliva specimens. So saliva specimens can be used to measure hormones or alcohol or other drugs. We would collect the saliva for hormone testing, are typically frozen and packaged in ice before sending to the lab for testing. Patients receive a kit. So this is more or less, they're kind of doing this at home. Day, night before saliva collection, patients should avoid using facial lotions and creams. Oral fluid mouth swab drug test. Patients should avoid mouthwash. Do you know why? Mouthwash has alcohol in it. Okay, so anything that contains alcohol should not be in the mouth. All right. Also, we look at gastric fluid or stomach fluid. We're looking for things like red blood cells, yeast, or pus from a wound. Collection procedure for gastric fluid, patient must fast for 10 to 12 hours before that procedure, okay? And in this procedure, a nasal pharyngeal tube passes through the nose into the stomach, and then it pulls out the stomach contents. Again, you won't be doing that one either, okay? Okay. The test used to diagnose whooping cough, croup, and pneumonia is the nasal pharyngeal culture, so NP cultures, okay? The following tests are performed by a physician, except the urine specimen, okay? So they're going to do amniotic, synovial, and cerebral spinal fluid. You would not be doing it. You guys would be doing the urines. The following body fluids are always treated as stat specimens except for urine, okay? So peritoneal fluids are always stat, spinal fluid is always stat, and synovial fluid is stat. All right, let's go to the end of the chapter. You guys can unmute if you want. So I can't stress enough, because as I go through these slides, I look at your faces and I see this deer in the headlight look. Like, I don't know what she's talking about. Okay, so don't get hung up on that. I think the best thing, by me looking at your quizzes, I think the best thing for you guys to do is really concentrate on those evolve test banks, number one. Anytime I'm sending you those, help me out, Rebecca. Kahoots, thank you. I think those are really helpful. And once we start getting into really studying for the one exam, I'm not talking about the EKG or this phlebotomy. Once we go into studying for the certified PCT exam, there's two on there. It's I think it's it is the actual questions that'll be on the test. There's two different, there's part one, part two. I think we really are going to start focusing on using that Kahoot. I think that'll help. And if you guys, I don't know if I send it to you, but I will send it to you after this lecture, those two. So you can kind of start looking at that. Because I think, if you're sitting around, pull it up, go through it once, keep doing that, because eventually you're going to get them more and more of those right. And this is all going to make sense. Okay. And Emily, don't focus on all of this overwhelming you. I think we need to really focus on, number one, getting the PCT certified, right? The other two are great to have, but don't stress right now. I know $117 isn't easy to come by either, but let's do one thing at a time. Let's get the PCT under our belts, okay? We'll get this going, but let's get that. And then I think if you keep practicing, I think that's going to be more than me lecturing you this. I have to do this, and I think it does help a little, but I don't know that it's going to be 90% off these lectures. Does that make sense?
Do we take the certification exam after we graduate?
It'll be part of our program. So let me look at my little schedule here. So we go, and the way we're going, now remember, these last 2 weeks, I've poured it on you guys, okay? Because you didn't have clinicals. We're gonna slow down as far as lecturing. I still will have you be doing a lot of these evolved test banks and the Kahoot stuff and that, so that we can keep practicing that stuff. But we get to slow down a little bit, and you guys get to actually do hands-on stuff now. Okay, so it'll slow down for the next few weeks. Okay, now the way it looks to me is we kind of finish up. We kind of finish up on week 13. We have like an exam on week 10, and then we start, because there are 12 weeks, I think. Okay, so there's 12 weeks. So on week 10, we do an exam for all this, I think, okay? And then we begin to start doing online practice exams. So we will be doing together as a group online practice exams for the PCT and for this other stuff, okay? So we will be focusing so we will be focusing at least 2 weeks just on practicing the exam.
Okay,
so
that makes me feel a lot better.
Yeah, so we kind of finish up, and we may even finish up, tell you the truth, the way we're going. And I think now that we've included the Evolve and the Kahoot, I think that we may, if you guys want to, we may be able to finish up lecturing before that. And we may even be able to get 3 weeks of practice exams in, where we just keep hitting it over and over and over. But I'll let you guys kind of guide me on that. If you want to do that. For me, I would want to do those practice exams as many times as I can, just to see what I'm doing. And hopefully I think the way that Becky told me, she said that we can actually schedule all of you guys taking the practice exams at the same time, kind of doing it as a group. We can kind of do it that way. So we'll see how we do it, but we definitely need to get into doing those practice exams so that we can keep trying to get a better score and get a better score. Okay. You know, I'm not asking for 100%, but it'd be nice. No, but we need to get to that, whatever that score was. I can't remember right now off the top of my head, but there's a acceptable score if you remember.
Yeah, you can miss like 110, like,
There's quite a few. I mean, if I remember, I think it's in the beginning of this book.
How many questions are on the test?
Let's just
test.
let's just look at this. So I think that's in the back here. So have you guys looked a little bit through your book?
Yeah.
I mean, and what I think we'll also do is we'll go through those chapters because it kind of summarizes all the stuff we've learned for the last PCT 102 and 101. And it's really done a really good job of narrowing it down to a couple paragraphs for each.
Yeah.
Did you see that? I mean, that's the nice thing about it. Okay, let's see here. Where is that? Well, anyways, it's somewhere in here where it was telling us what we had to do. I know I saw it somewhere. Let's just see here.
It's like there's like 500 questions, and then you can get 390 of those right to pass.
Right.
Yeah, scaled score of 390 out of 500 is required to pass.
What page is that?
It's at the very beginning after the
Yeah.
page for the third page.
Yeah. So, I mean, you've got a little bit of, you've got a little wiggle room there.
And there's 120 questions.
Yeah, there's 120 questions. There's 100 scored items. Yeah, so a scaled score of 390 out of 500. That's pretty good. I mean, that gives you some wiggle room. So, I mean, I think if we keep practicing, and like I said, well, while I'm thinking about that, I did send you guys, okay, we're done with this, aren't we? Yeah, no, we got to still do the questions. All right, I want to make sure we do the questions, and then we'll kind of review for the big test Monday. Tuesday. That is so funny. Why I can't get that on my hand. All right, so let's go through these questions real quick, and then I'll keep going here. Page 244. So, an 8-hour urine specimen is typically collected when?
A.
A, in the morning, right? Because you've slept all night. All right, what urine specimen is most commonly used to determine pregnancy?
C.
All right, first morning. Why is that? Because our hormones are up highest at that time, right? Okay, the sweat electrolyte chloride test is typically used to screen for
C.
Cystic fibrosis. Good. Urine specimen is laid before, after, by the patient, or on the lid?
After.
After. A catheterized urine sample may be collected because?
All the above.
All the above. A 72-hour specimen is collected to determine?
A.
Fat quantities. A semen analysis must be?
A.
Delivered within 30 minutes. The following body fluids are always treated as scat specimens except for?
A.
Okay. The test used to diagnose whooping cough, croup, and pneumonia is?
B. Boy.
Yep. NP culture. And the following specimens are always collected by a physician except?
Boy.
B.
Urine. That's right. Okay. Now I sent you a Kahoot today. And it was on the order of the draw. Okay.
I have to go use the restroom. I'll be right back.
All right. So make sure you look at that Kahoot really careful and try to get that under your belt, because that will probably be on the exam, is the order of the draw. Okay. I'm not going to get too heavily involved in what is in each tube and et cetera, but I do want to spend a little more time on that as we progress. Okay. But we'll worry about that later. So on your exam, once you guys want to go through it?
Yeah.
All right, we'll go through it. Then Rebecca, I'm going to go look at that. After we get off here, I'll look at that stuff, okay?
Okay.
Why that did that.
The fonts was different too. Like there was small font on one question and big font on another.
I do know that was true, yeah.
Low battery.
You have a low battery?
Yeah.
Uh-oh.
I'm going to go get a charger.
What'd you say? That's what I'm done. How bad?
Thank you. So let's just go through these questions. So a diluted solution of which of the following is a disinfectant against bloodborne pathogens on countertops? Is it acetic acid, bleach, iodine, or Lysol?
Bleach.
Good. Is Emily in there yet? All right. A phlebotomist must ensure that the patient understands and agrees that his or her blood is going to be drawn. What is the name of the process? Is it confidentiality, informed consent, legality, or privacy?
Informed consent.
Okay. What's that noise?
I have no idea.
Meredith, what are you doing?
I don't know.
Is
It just
Emily
popped up.
with us? Okay, I'm going to keep going because we got to get going. After becoming certified, what is required of you to keep your certification? Do you need to?
CEU. Sorry.
What? No, do it.
CEU.
CEUs, that's right. What is your, as a phlebotomist, what is the biggest occupational risk for you?
Accidental needle stick.
That's right. All right, needles and lancets are which type of safety hazard?
Sharps.
Sharp. All right. How long should you wash your hands?
15 minutes.
15 seconds.
Second?
Oh,
That's funny.
oh gosh.
You would be very thorough, Emily, and very clean.
Yeah.
Although you'd only get 2 sticks done in one day, but yeah. All right, girls. Sodium, potassium, and chloride are part of which panel of tests?
Electrolytes.
Electrolytes, that's right. What's the most common allergy in healthcare?
Latex.
What?
Latex, right. Which is the single most important means of preventing the spread of infection?
Wash hands.
That's right. All right, so this is that, the PPE stuff, okay? What is, when donning a gown, mask, respirator, face shield, and gloves, which do you put on last?
Gloves.
Gloves.
Right. How about when you remove PPE, which one comes off last? Or what do you do
Glove.
last?
Gown.
What do you do last, I should say?
Wash
Wash.
hands.
Wash your hands. That's right. That you take everything off and then you wash your hands. Do you remember the correct way to take things off?
It's been a while.
All right, let me go through it so you just kind of refresh. So gown and gloves, goggle, mask, then you perform your hand hygiene. Okay, so remember how you roll the gown off into your gloves and that take, okay. All right. Which anticoagulant is used most often in collection tubes for hematology studies? Is it citrate, EDTA, heparin, or fluoride?
EDTA.
Yep. All right. You've entered a patient's room and explained that you're going to do a blood draw, and the patient says, "No way, Jose." What do? Do you attempt to draw it? Go ahead, tell me.
Find the patient's physician and tell him.
That's right. Which term refers to a rapid, severe, life-threatening immune reaction?
Anaphylaxis.
That's right. Which of the following hematology tests measures the blood's capacity to carry oxygen? Do you remember? All right, I'll give you them. Differential, hemoglobin, MCV, or white blood cells?
Hemoglobin.
Hemoglobin. Hemoglobin carries oxygen.
Can you put this on Blackboard so we can study it?
Which color tube may be used to obtain serum for a laboratory test?
The gold.
Red.
Red. Yes. And we're going to get more into this, but just remember some of those. You might want to review that part, okay? So what you might want to go to your color tube and kind of see what they're for a little bit, okay? But red is for serum.
Would you be able to make a Kahoot about just the blood containers?
I'm working on it right now.
Okay.
I started the one that I just sent you, which is the lab draw. I think I'll include that on that one.
Okay.
Can you also put this Zoom on like Blackboard?
Yep.
Okay, thank you.
What is it now? Last time I tried and it wouldn't let me do it. So Meredith, I'm not promising you 100%. Okay. The last time we did it, it wouldn't go on there. So I don't know why.
It wouldn't load on the email for me either.
It was not working. So I don't know what happened with that. So we'll cross our fingers on this one. So make sure you're kind of listening. All right. What is the most common antiseptic used in routine venipunctures?
Isopropyl alcohol.
Very good. Routine. Yep. What's the purpose of a tourniquet? Let's see let me give you the answers, okay? To stop bleeding, to prevent venous flow out of the arm, to increase venous flow in the arm, or to shrink the size of the vein.
Boy.
Boy. Right. So you don't want the blood leaving the arm. Okay, so keep the right, okay. What's the most common gauge used for routine venipuncture?
21.
21. Which of the following indicates the largest sized needle? 16, 23, 20, or 21?
16.
16. Okay, which is not an anticoagulant? Uh-oh. Okay. Polymer gel, sodium heparin, sodium citrate, or EDTA?
Palmer Joe.
Right. Blood collected in a lavender top tube is used for what test?
BBC.
BBC. Very good. How many times may needle be used before discarding it?
1.
Thank you. All right. Tourniquets should be placed how many inches above the venipuncture site?
3 to 4.
3 to 4. During the venipuncture procedure, the tourniquet should stay on no longer than
A minute.
a minute.
1 minute.
Which vein is the first choice for venipuncture?
The medial.
Median cubital. That's right. All right. At which angle should a venipuncture needle penetrate the skin?
15 to 30.
Yep. When should the tourniquet be removed from the arm in the venipuncture procedure? You do it.
Before the needle is removed.
Yep. So you're gonna take the tourniquet off before you remove the needle.
Tourniquet.
All right. The smaller the gauge number, the
Larger the lumen.
That's right. All right. Written information about a chemical, its hazards, and the procedures to clean it up or the first aid needed is in what kind of manual?
Safety data sheet.
Right. Or SDS. Good. All right. What else we got? Hold on a minute. Where'd it go? All right. Make sure we get them all here. Okay, so a PCT is preparing to perform a venipuncture, and the patient starts saying that they're nauseous. What do you think you should do? And I'll give you the answers. Position the patient's head between their knees, reschedule the venipuncture for another day, instruct the patient to consume a full glass of water, or encourage the patient to take deep, slow breaths.
Deep, slow
Deep,
breath.
slow breath.
Right. Okay, how long do you keep the infant heel warming device on before you do a puncture?
3 to 5 minutes.
Good. What's another name for white blood cells?
Leukocyte.
Leukocytes. That's right. All right. So a good candidate for dermal collection includes, I'm going to ask you these, okay? Require frequent collections, are obese, are severely dehydrated, all the above, or A and B only.
All the above.
Right. Okay. Let's see what else you guys might need to know. Okay, what is the inherited disease that causes decreased blood clotting? It makes you bleed out.
Hemophilia.
Yep. Which medication interferes with a BT test? Salicylates, ibuprofen, aspirin, or all of them?
All of them.
Okay. What finger do you usually use for a capillary collection?
Ring.
Ring.
Right.
Good. Which anticoagulant is used most often in collection tubes for hematology studies? You already did that one, never mind. Well, what was it?
EDTA.
What is the preferred method of blood collection on a newborn or an infant?
Dermal.
Dermal. Good. All right. And this is the one that you were talking about. So I'm going to go back and look at it. Okay. What antiseptic must be used when collecting a blood alcohol test? Okay.
D.
What'd you say?
C and D.
Yes, C and D, but what are they? So let's make sure we know what they are. So is it isopropyl alcohol, ethyl alcohol? Is it povidone iodine or BZLK?
BZ, allocaine, and
Iodine.
Iodine, right. The smaller the gauge number, you already did that one. Emily got that one, I think. Let's see. Oh, okay. How about this? The location of a heel stick is?
Medial and lateral.
medial or lateral.
Yep. Okay. The PCT is placing a label on an evacuated tube. Which of the following actions should the PCT take? Do we write the date of collection on the label before performing the venipuncture? Do we apply the label immediately following the venipuncture? Do we verify the patient's room number with the tube label following the procedure? Or write the initials of the provider who requested the draw on the label?
Fill out the label immediately after.
That's right. So we're going to apply the label after, not before. Okay. Okay. Here's one that you may not know. A PCT collects a specimen in an EDTA tube. The specimen clots. This could have been caused by which of the following? Okay. The PCT shook the tube to mix the additive. B, the collection tube was past its expiration date. C, the collection tube was stored at 20 degrees Celsius. Or D, the PCT did not draw enough blood.
Could it be the shaking?
So this one would be because the collection tube was past its expiration date. So it's really, really important that those are checked before you even use any kind of tube, because you could have a beautiful draw, and if it's expired, it could alter the test. Okay, and in this situation, it altered the test. So that's the issue. Which of the following indicates proper use of an evacuated tube system for blood collection? A, use once per patient. B, used if package is damaged. So you want to use it if the package is damaged. Use it if it's past the expiration date, or use it if the package is open. Okay, so do we want to use it if the package is damaged?
No.
Okay. Do we want to use it if it's past the expiration date?
No.
And do we want to use it if the package was open?
No.
Okay, so that's how you eliminate those. Those would be silly if we did that, right? But we would use it only once per patient. All right. Okay, a delay in the transferring of a specimen from a syringe to a vacuum tube might cause which of the following? Hemolysis, hemoconcentration, low volume, or specimen contamination?
Hemoconcentration,
And what is hemoconcentration? Does anybody remember?
the ratio.
And what is hemolysis? Somebody tell me what hemolysis is.
All the destruction of red blood cells.
Right. So it actually would be hemolysis. Okay. So a delay in the transfer of taking it from the syringe to the vacuum can cause hemolysis. Okay. All right. A PCT has completed a blood draw. What should the PCT include on the label? Do we put their phone number, their next of kin, their identification number, or their address?
Identification.
Yeah, identification number. All right, why should a PCT keep the specimen container in a vertical position with a stopper up during transport? A, it allows the specimen to mix vigorously. B, prevents hemolysis. C, prevents clot formation. Or D, encourages the growth of microorganisms. Why do we want to keep it upright?
Prevents hemolysis.
It does. Yep. All right. got that one. You guys know this one. Which color-coded tube does not contain any additives at all?
Red glass.
Yep, red glass. Okay. And then one of the last questions on there are the order of the draw. Okay. And I've already included that on the thing that I sent you on Kahoot. All right. I'll keep working on that other part today to add to that. Probably, I'm hoping I can add it to that one that I just sent you. If not, I'll have to develop another one, but that's okay. All right. So I would, almost every one of these we've already done in the 2 quizzes that we've done already. So you guys should do okay. I'm going to go back, Rebecca, and check that one question out right now. Okay. And I'll let you know about that. Any other questions, girls?
Mm-mm.
Okay. Next week, make sure you get on Learning Board. I would do it this weekend so that you know what's expected next week. I think next week we are learning.
Oh, I had one question.
Yep.
For the clinicals, we wear our same blue scrubs we bought, right?
I think so. You guys, you got the protocol, right?
Yeah.
I think so. I'll reach out and ask that question just to verify, but I'm thinking everything's the same other than anything that sent you on that protocol. Make sure if you haven't sent me that form, you send it real soon because you're going to need that before you go next week.
I'll get it too.
I think that was all of that. But next week we'll meet Tuesday. We'll have the exam, and we're going to go through 16 and 17. Okay.
We don't meet Friday though, right?
You don't. You guys have a 10-hour day Friday, right? So you don't need me. All right. I'll get working on that stuff right now for you guys. And I think you'll be fine for this exam. You guys do most of these anyways. All right.
All right. Thank you.
See ya.
Bye.
Bye.